So a lot of people want to know what happens when they request an epidural. And the process is fairly simple. You get to a point in your labor where you say, you know what, I'm ready. I'm ready for some pain relief, and we let the nurses know. And the nurses will give a call to anesthesia, and an anesthetist will come and they'll speak to you about the benefits and the risks of an epidural. And they're going to go over any information that's relevant for your particular case. There's certain times where medical conditions may not prevent you from getting an epidural, but they do inform maybe where the epidural is placed, whether it's a combined epidural spinal, or if there's anything that they need to be aware of should anything change throughout the course of labor. So things like that are whether you have any loose teeth or any caps or veneers. It might be if you've had any complications throughout your pregnancy, such as high or low blood pressure, information that's important for anesthesia to know. And then by the time anesthesia gets to your room, because they're not waiting outside in the hallways ready to jump in anytime someone asks for an epidural, the nurse will have already set up the cart for the anesthesiologist. And what's going to happen is the anesthesiologist is going to have you sit on the bed, and they're going to want you to sit as far back to the edge of the bed as possible, and it's going to feel a little bit like you're 3 again because your feet are going to be dangling over the edge. And a really common question I get asked is, well, how do they do it while I'm having a contraction? I thought I needed to stay still. And the truth is, you do need to stay still, but I've also never seen a more motivated woman stay still than the woman who is ready for her epidural. So I'm sure that with the help of your nurse and your care team, I promise you'll be able to stay still while the anesthesiologist does the epidural. And what they do is sometimes hospitals have different policies around who can stay in your room, and sometimes that means that everybody has to leave except for the medical team, and other times your partner can stay but your doula or your mom or your sister have to leave. Other times the staff are all right with both a doula and a partner staying, or a mom and a doula staying. It really depends on your hospital, and sometimes it even depends on the individual anesthesiologist. But once they have the right people in the room, it's a very quick procedure. They're going to put a drape up on your back, and they're going to sterilize the area, and then they're going to give you a local, which is just a really small needle, and it's going to burn a little bit. That's actually the most painful part of an epidural, is the local burns, kind of like a bee sting. And then they're going to give you a pillow, and they're going to ask you to hunch your shoulders over, and what they want you to do is round yourself around your belly as much as possible. When you curve your spine like that, you open the most amount of space between your vertebrae, and that gives the anesthesiologist the most access in order to give you the epidural. And then once you're numb, the anesthesiologist is going to insert the catheter that's part of the epidural, and they're going to give you what they call a loading dose. And that loading dose is to make sure that the epidural is placed in the right spot and that it's working. And then once the anesthesiologist has had 15-20 minutes, your legs have started to get heavy, you're starting to have some numbness, they're going to suggest to the nurse that they can take the loading dose off, which is just a syringe attached to the catheter, and that they can hook you up to the pump, and then you have the constant infusion of medication, which is keeping you comfortable.